Welcome back to Rungta IAS Academy aspirants. Let's get straight into today's explainer, which is absolutely crucial for your UPSC preparation.
Spot on. We're unpacking a high-yield, heavily debated topic that hits both your General Studies Paper 2 on social justice and Paper 3 on the economy. We're looking at the great health insurance paradox.
Here is the central puzzle. If health insurance coverage across India is rising so rapidly, why on earth are households facing more financial distress than before? The latest NSS 80th round data on health consumption, conducted between January and December 2025, paints a very contradictory picture that you absolutely must grasp for your analytical questions.
The data is fascinating. Despite a massive push for government-financed health insurance schemes, what we call GFHIs, like the Pradhan Mantri Jan Arogya Yojana, hospitalization rates are actually staying below 2014 levels. At the exact same time, we're seeing a clear drop in people using public hospitals. The numbers just aren't matching the policy expectations.
And this figure really nails the contradiction. Right now, a massive 47.4% of rural households have health insurance coverage, along with 44.3% of urban households. Guys, that's more than a 2.5-fold jump since 2017-18. So the big question is, why isn't this impressive leap giving our citizens better, more affordable healthcare access? Let's break that down for your mains notes. We have to weigh the theoretical promise against the harsh reality on the ground. These schemes promised free care and financial protection against massive hospital bills. But the reality? Out-of-pocket expenditure on hospitalization has literally more than doubled. Excluding childbirth, rural citizens are shelling out an average of 31,250 rupees, and urban citizens are paying 34,259 rupees. Very few are actually getting the promised free care. This contradiction exposes a massive structural issue. We are seeing a huge behavioral shift. Out of the people enrolled under these GFHIs who actually need to be hospitalized, a staggering 57% are heading straight to private hospitals. Schemes like PMJAY or Swasthya Sakti in West Bengal are basically redirecting patient traffic straight into the private healthcare sector, which remains largely unregulated. Aspirants, pay close attention because you need to quote these structural drivers in your GS3 answers. What's forcing these out-of-pocket expenses up? Even in public hospitals, patients are hit with high costs because medicines and diagnostics just aren't available. Plus, there are heavy non-medical transport costs. Meanwhile, in the private sector, average hospitalization expenses have skyrocketed by 70% in rural areas and 80% in urban areas. The financial protection mechanism is clearly breaking down. This leads to a critical socioeconomic point. Severely skewed equity benefits. In urban areas, only 13% of the people actually using hospitalization services under these schemes belong to the poorest class. So while socioeconomically backward sections might look covered on paper, the on-the-ground utilization disproportionately benefits the relatively better-off sections of society. Let's tie this data directly to macroeconomics. This model is putting a massive fiscal strain on our states. Because many states extended coverage to non-poor populations, the overall utilization shot up. In states like Haryana and West Bengal, nearly 15% of their entire state health budget is swallowed by GFIIs. Essentially, public tax money is subsidizing care in a private sector built on profit maximization with very little incentive for social solidarity. This strain is even causing delays in reimbursing the private providers. Which brings us to a brilliantly powerful statement from the source analysis. Keep this high-impact quote up your sleeve for your UPSC interview round or an essay paper. Looking at the first 7 years of these schemes, the analysis concludes they are of the rich, for the profit, and by the poor people. It's a stunningly accurate summary of how public funds are currently moving through this sector. So what's the way forward for your conclusion? We clearly need a pivot. The analysis suggests shifting away from this heavily insurance-led model to get back to strengthening foundational public health care. One glimmer of hope is the Ayushman Arogya Mandir, or AME. This is PMJAY's counterpart, aimed at giving comprehensive primary care, including for non-communicable diseases. But, and definitely note this in your answers, it remains severely underfunded, much like the National Health Mission. To wrap up today's explainer, we want to leave you with an analytical question to chew on. Is it time to rethink this insurance-led model of universal health coverage and instead refocus our resources on building a public healthcare system that delivers universal, comprehensive care? I encourage you to critically evaluate this and weave these insights directly into your prep. Thanks for tuning in and keep studying hard.